Hello, I'm Dr. April Oliver with today's Vision in Tomball. Today we will be discussing dry eyes. It is by far the most common medical condition that I see on a day-to-day basis. So let me start by asking you some questions. Do your eyes ever get red? Do they water or get irritated when you have air blowing on them or when you're on the computer? Does it ever feel like you have sand or grit in your eye? Does your vision get blurry and blinking helps to make it better? Do your contact lenses start to dry out around 4 or 5 o'clock and then you have to put lubricating drops in on top of them? Do you have dryness when you wake up in the morning? If you said yes to any of these questions, most likely you have some degree of dry eye syndrome. So what causes dry eye and how do you treat it? There can be both internal and external factors that lead to dry eye. But first let me explain about the tear film. We have two main types of tears, the good moisturizing tears and the reflex crying tears. The reflex tears are usually brought on by emotions, but also can be triggered when your eye gets irritated. If your eyes are watering, that typically means that they're dry because they sense the dryness and they're trying to compensate by reflex tearing. Therefore, if we restore the good lubricating tears, then it will help to reduce the reflex watering. Other forms of dry eye can be caused by age, hormonal changes such as pregnancy or menopause, certain autoimmune disorders, or even certain medications and chemotherapy. A lot of times people with this type of dry eye also have dry mouth. Also, people who have had refractive surgery such as LASIK are more prone to dryness. Depending on the type of dry eyes that you have, I will usually recommend starting a natural treatment regimen of warm compresses and lid scrubs. Other things that have been proven to help with this type of dry eye are omega-3 vitamins such as fish oil or flaxseed oil, or possibly even antibiotics. There is also a new machine called the LipiFlow system, which has small heat pads that connect to the outer edge of your eyelids for approximately 10 minutes. It helps to break down the oil that is clogged inside the oil glands and is typically only done once every 6 to 12 months. The external factors that can contribute to dry eye are windy and dry environments such as the beach or high altitudes, or being on the computer for long hours, which causes our tear film to dry out because our blink rate decreases. Therefore, it is important to take breaks when you're on the computer, and remember to blink when you're looking at a screen for long hours. Drink plenty of water, avoid air blowing directly on your face whenever possible by turning vents away from you in the car, not sitting directly under a ceiling fan, or wearing sunglasses when you're outside to shield your eyes from the wind. And finally, the use of artificial tears can also be helpful. However, it is important to avoid the use of certain drops that, quote, get the red out, such as Visine and Clear Eyes. These type of lubricants are addictive and have a drug in them that shrinks the blood vessels to make them appear less red and irritated. But they will eventually cause your eyes to become more dry over time. I prefer the use of preservative-free tears because they are better for you and less likely to burn or sting. If just natural methods are not improving the dryness, then we must kick it up a notch and resort to other methods. An example of this would be using medication drops, such as low-dose steroids to help minimize the inflammation on the surface in the short run. We also sometimes must use Restasis or cyclosporin to manage the inflammation in the long run. Other treatments include implanting small tear plugs into the puncta or tear duct in the corners of the eyes. This is a completely painless procedure and it is reversible. It helps to keep the tears from draining down the canal and into the back of your throat. This therefore keeps the tears on the eyes for longer. I hope you all have learned something. If you are suffering from dry eye or having trouble with your contact lenses, please come and see me. I would love to help you see and feel better. Thank you.